Hello, everybody. Buongiorno. Welcome to the session of today. It has been a real pleasure watching all these excellent sessions over the past few days. Only ISPI can do that. This panel today is Rethinking Security, People's First, the Human Security Paradigm in a Time of Pandemic. With us, we have an excellent panel of 8 experts coming from different disciplines and with various affiliations and coming from different countries. It will be a fantastic debate around the human security, about post-COVID, or during COVID and post-COVID era. Clearly, the COVID-19 pandemic has demonstrated that the concept of security is not all about military. It actually extends to other areas. Something that might have started as a health risk, and it went on to create risks elsewhere and spilled over the areas of climate, environment, food, water, and it provided new threats across different countries. So MENA countries being vulnerable from the outset, different people have different experiences, which we will go over. Now, one thing that was clearly demonstrated through these crises and the way that governments and people managed it is that this entire definition of risk as well as security have to be redefined. We need to have a more holistic approach where we have to factor in other areas, other risks, and of course, build human development as a center ground for further action. So many countries found that they need help, that they were interconnected, they would require collaboration. So if anything, this crisis demonstrated that an international multi-party collaboration as well as a multidisciplinary approach would be required to tackle all these big issues. So in this context, we are very lucky to have experts from different disciplines, and you have the program and the biographies to refer to. I'm not going to go through them, but their focus would be on the MENA region and how to better build a secure environment and how soft power and hard power can be used to secure better cooperation and engage various parties in a more constructive dialogue. I have with me, I'm very lucky to have Enrica Toninelli as my co-coordinator or moderator. She's Deputy Editor-in-Chief of Ray News. And we have a panel of 8 speakers, and with us two, that is 10. We have 90 minutes. Therefore, the time has to be fairly divided, and it's just about 9 or 10 minutes per person. So I would urge you to be straight to the point, highly focused. There will be questions and answers, and we need to have a good debate between us. So with that, I'm going to hand over to Enrica to introduce the panel and the first speaker.
Thank you, Glauer, for your perfect introduction to this panel. We have the pleasure to discuss this issue with 8 speakers who are connected via Zoom, unfortunately. I hope next year we'll be all here in Rome. And we have the pleasure to have Chu Dongyu, Director General, Food and Agriculture Organization, Nasser Kamel, Secretary General, Union for the Mediterranean, Washio Eihiro, State Minister for Foreign Affairs, Japan, Hu Hongbo, Special Representative of the Chinese government on European Affairs, China, Ahmed Al-Mandhari, Director Regional Office for Eastern Mediterranean, WHO, Valerie Guarnieri, Assistant Executive Director, World Food Programme, Baiba Braže, Assistant Secretary General, NATO, and Serwan Esmaeil, Secretary General of the Council of Representatives, Iraq. So, I would like to start with Chu Dongyu. I hope he is connected with us. Okay, I see you. Hi, welcome to this panel. Mr. Chu, at the beginning of November, you warned the international community that the health crisis will have long-term effects on food and nutritional security. Among others, you emphasized the impact of the pandemic on food production. Can you explain how the Food and Agriculture Organization has been working with national government to tackle this issue?
Thank you, moderator. Good morning, everyone, and from Rome. And the Italian government is so generous hosting the FAO UN organization. It's one of the largest professional UN organization. So I'm here, it's on behalf of agricultural food sectors. As you mentioned there, and we are facing the big pandemic. In general, food system has been improved far resilient to the effect of this pandemic. You know, they look at all the big major producer of the food sector. This year, it's December. We can say it's one of the best sector tackle this big recession and a big challenge. So for the market is relatively stable because we are started early March. We work together with my colleagues from WHO and the WTO. We send a clear message. We wanted to avoid the prices like food prices crisis, 2007 to 2008. And this time, and even that time, we didn't expect that the pandemic is so serious globally, but we have established early warning systems by the big data and the information sharing, and also service to the members. And also, I think also we have already, you know, at that time, we encourage member countries through the G20 Extraordinary Summit, Ministers of Agriculture meetings, and the European commissioners, and also Africa minister meetings in middle of April, and also strongly encourage all the running the agricultural calendar, because that time it's a spring. We have to produce more first. Yeah, produce more, and this for perishable food, you you have to produce more locally. But at the same time, we work together with WTO colleagues and others. We keep the international trade functional and effective. I think in general, global picture is rather good. But of course, the national level, the differentiation is there among the members. And the local level, even more complex situation, especially when you relate it to the perishable products, and the price is really high. So I think in short, we offer we build up the digital FAO to offer the information of the marketing, production, and others service too. That really helps. Second, also we have a lot of interaction and meetings with different levels and with different groups. That also helps to get a real picture of global picture. Third, I think also we appreciate all the key players to really offer their support for FAO mandate, and also a host country agreement, host country here, Italy. I appreciate very much the Italian government. We launched together the food coalition during this pandemic, and together with other top key players of our members. And last but not least, we're strengthening the hand-in-hand initiative implementation to help the vulnerable countries. It's about 53 countries, most vulnerable countries from small island state, landlocked, and also the least developed countries. So that's really to help build up the resilience or inclusiveness. And so far, we are seeing, even we predict maybe we have added more, 132 million poverty, food insecure people. The situation is even worse next spring. But if we keep more solidarity, more coherence, and more passion, a big passion to help each other, and then we can overcome this pandemic within next months or following months. And I'm quite optimistic. Thank you.
I would like to ask you one more question, Mr. Chu, and hoping that this passion you are mentioning will be really widespread approach. Let's talk about Africa, a continent which really needs some passion, because it's for sure the continent that will certainly suffer the most from the food insecurity in the short term, as you well know. At the FAO Regional Conference for Africa last October, the need to transform Africa's agriculture and agri-food system took center stage. In your opinion, which role can innovation and digital technology play to achieve this goal?
Okay, thank you. Yeah, since
Axel Berkowski,
thank you. Someone not mute. And thank you for your question. And I think Africa situation in general, it's a most vulnerable country, LDC located. Is some also other conflict area. So that's why the Africa in general, we have to more zooming, pay more attention to that. That's no doubt. Second, Africa, I think, now facing the challenge, especially in the eastern horn of Africa. That's not only the pandemic, and also the locust and follow army war. And some countries are conflict, some countries also the flooding, drought. So that's really overlapping, a threefold in fact. So, but Africa, they have full of potential producing enough food. If you introduce innovation, not only technology innovation, and also the policy innovation, and also the business model innovation. So a lot of people talk about the technology innovation, years and years, because I was a scientist. Why you talk about innovation? But actually, for the international or national governance, you need the innovation three aspects. So That's, I think, we really share with Africa. That's why we are first minister meeting together with Africa. That was 16th of April. Yeah, we are not only invite the Minister of Agriculture, Food, and also we invite the Minister of Trade and the Minister of Financial. Later, we established a task force to do so, and not only a meeting. And we want to have a more tangible result. And then for how to change the business model for the FAO, we have 4 functional to all the members, especially for Africa. First is the policy consultation. So we want to have them to establish a more tailored policy to the individual members. Second, I think capacity building. So that's why we wanted to invite the European Union and China, Japan, America, others. So that's why I come to the day one, we launched the hand-in-hand initiative. That's really changing the business model because any country who can offer, it's a donor country. And no matter you are from OECD or even from the China or from Turkey, yeah, you can offer something, you are donor country. And then all the country who get that, it's a recipient country. So hand in hand, it's a matchmaking, yeah, country-owned, country-led initiative. And that's a change of business model. Second, investment. So just this week, yeah, from Monday, we are still not finished, but we got full support of the members to approve the private sector engagement strategy because investment is essential for Africa, for agricultural infrastructure, for capacity building, and for the all the related for broadband. It's not that you want to develop digital agriculture, you have to have a good broadband and connection. So I think we have to change the business model, the way of investment. And then, of course, we wanted to build up some kind of case. So during the regional conference, we launched the 1,000 digital villages initiative, specifically, I think, for the Africa and for Asia, Pacific Island, and Latin America. I said it's 1,000 digital villages. It's just symbolic. It's not means only 1,000, maybe 10,000 or 20,000. So that's a way to have the transform agro-food system on the ground to benefit to the smallholders and get their small production based on the codex, based on international standard, and then sell online to Europe, to Italy, to Asia, to Japan, to China. So that's not the traditional business model. And the last but not least, I think we should respect the indigenous knowledge and practice, best practice in Africa. They can, a cultural characteristic with regionalization and localization. Any country, any region, even Italy, south, north is different. You deal with the same agricultural commodities. You produce rice here is different from China, from Japan. So agricultural technology and the digitalization should be localized and fit the purpose, fit the local environment. So in that way, I think we can really have Africa to modernize their agri-food system. And at the same time, they really beneficial to the smallholder farmers and help them to get international marketing access and to guarantee their food security. Thank you.
Thank you very much, Mr. Chu.
It's enough, okay. We're running out of time.
I think you both did very well. I was impressed by staying focused and sticking to time. But Mr. Nasser Kamal, maybe we should better that, and we should also keep the momentum going. Mr. Kamal is Secretary General of the Union for the Mediterranean. It's quite a title and quite an international community to deal with. We've got this north and south divide in the Mediterranean. We've got the rich and poor. We've got security issues. We've got oil and gas issues. So I feel for you. I know how difficult your task is. But last month you had you hosted virtually, hosted all the trade ministers in your conference, and you famously said that we need to get back to a new normal. And you thought it cannot be done without the economic integration and trade being the ultimate focus. So that implies that this is yet another difficult objective to achieve. So please tell us about the obstacles you face in that regard.
Well, let me start by thanking you very much for having me in this very prestigious panel. And indeed, it's not easy to be in charge of a multilateral organization trying to bridge the gap between north and south of the Mediterranean. And let me start by pointing some of the facts, actually, that this region is facing, and especially in the area of economic integration. We are, unfortunately, one of the least economically integrated, or rather, say, one of the most economically fragmented region in the world. Just a small clarification, 90% of intra-regional trade in the Euro-Med region is confined between the EU countries themselves, and another 9% are between the EU and its southern and eastern neighborhood, while only 1% is happening between the south themselves. And that's why, because the whole economic infrastructure in the Mena region actually is designed to be serving its trade with the north or with the developing world rather than the developing world. And if we add the impact of the pandemic, studies are showing that we are going to witness somewhere between 35 to 40% drop in trade this year and maybe next year. So that in itself is a huge challenge, as you just mentioned. So I dare say the new normal should not look like the old normal, because the old normal was not sustainable environmentally, in so many other ways, but also when it comes to trade. And there is, and there were, a lack of political will in terms of increasing our level of regional integration. Trade barriers, lack of transparency, regulatory framework has, in a way, slowed down our ability to grow together. Just a small number. We know that it costs 4 times more to trade between southern Mediterranean countries than it does between northern Mediterranean countries. And it takes 3 times longer. This is unacceptable. So those factors are hampering regional and trade investment and are costly to our ambition to build or to co-build prosperity in the region. So during that particular meeting of trade ministerial, we have put in place a set of measures and policies in order to try as much as we can to deal with those inadequacies and those regulatory and other measures that are hampering our capacity to grow together. At UFM, we're building what we call a Union for the Mediterranean Hub for Trade and Investment, where we will be training local authorities, even lobbying local authorities to do more and to do better in terms of expanding their cooperation and their ability to work together. Because as you said, security is a holistic issue. And if the South does not climb up the ladder of economic development, we risk to have more problems with migration, with radicalization, with political unrest. Another idea that this particular crisis that knows no border is pushing us to pursue is the whole idea of value chains. I mean, this crisis has exposed the limitation of value chain that depend on production centers thousands of miles away from home. So why not Europe is not looking closer to home? And by closer to home, I don't mean only the southern Mediterranean region. I look also to Eastern Europe in order to ensure economic autonomy on one hand, and in order to ensure co-creation of wealth and co-creation of.
Can I bring you back?
We are working on this.
Yeah.
We are working very much together on this. Thank you very much.
No, this has been great. This has been great. But I want to bring you back to Mena and to Mediterranean and your remit. What you're describing clearly is the real complexity, but actually not unique. I mean, wherever you look, we have the same issues, same problems, and the same dynamics. But if you look at the big picture, it might be scary. People might be overwhelmed by the problems. But when you break it down to its component, you might find areas where you can make a difference and provide a good example. In other words, there may be models that you can have starting small, starting sort of upwards in creating good examples of cooperation, because we've seen how in the COVID example, the area didn't do well, the collaboration didn't work out, and previously in climate, again the same. So if we expect ideal world collaboration, it may never happen, but where can you give us those examples where you can make a big difference and provide a good model?
Well, actually, climate change happens to be one of the subject where things are going, I dare say, much better than trade. But going back to trade, as I said, we have so many initiatives, but I'm not going to take your time giving you those examples. But when it comes to climate change, I would also stress that the old normal is no longer valid, because the old normal is not sustainable environmentally and from a climate change point of view. We at the UFM have focused in the beginning on providing our decision maker with science-driven facts on the ground. We have helped a network of research in assessing the impact of climate change on our region, and the results are quite alarming. We know that our region is warming 20% faster than the rest of the world. Having said that, this is one of the region where there is an overall consensus, north and south of the Mediterranean, on what to do in terms of mitigation, adaptation, depollution, and sustainable production models. We are preparing, as we speak, two very important ministerials, one on the blue economy and one on environment and climate change. And when I follow the discussion between the ministers involved and the high officials, there is a clear understanding that we need to first adhere to the Paris Agreement, that some of the investment that will be mobilized to put in place the new EU Green Deal would necessarily be extended to the southern Mediterranean shores. Even the new EU Southern Neighborhood policy and all its financial package is going to focus on investment and job creation, with a special focus on environment and environmental.
If I may, because we're running out of time, in less than a minute, I'm going to ask you a very important final question, if I may, and that is about women. Because at the union, you seem to be focused or spending a lot of time and effort in making sure that women are empowered, and we would like to know where the trend is going. Is it getting better or worse, and how women can feature in this new normality?
Well, a very quick answer. If you're asking me things are going better or worse, yes, they're going better in terms of women empowerment in our region, the Euro-Mediterranean region. But no, it's going worse. The condition of our women are getting worse because of the pandemic. As we all know, that people with pre-existing condition tends to suffer the most. And unfortunately, that applies to social segments that are more vulnerable, and women happens to be more vulnerable. So we are seeing loss of jobs much more among women than between men. We have estimates of 750,000 women losing their jobs in the southern Mediterranean region because of the pandemic, because they happen to work in area and sectors that are affected. Having said that, very quickly, in terms of advancing the women agenda, we're doing actually quite well. We are starting this year the first peer review mechanism where countries as far as Sweden and as far south as Mauritania or Egypt or Jordan will be comparing notes in terms of what they're doing and what they should be doing, and listening to our policy recommendation in terms of empowering women politically, economically, socially, and in terms also of giving the woman a job opportunity.
That's excellent.
So the overall picture is positive, but the pandemic has made the situation, even violence against women has increased by 30%. Thank you very much.
Thank you, Nasser. I would like now to welcome Washio Eiichiro, State Minister for Foreign Affairs, Japan. Hi, I see you. Good morning, welcome. And first of all, let me start with, I would like to ask you some questions on how Japan dealt with COVID-19, because I think you did it very well. Let me just put some numbers. Until the end of November, Japan had 2,066 deaths, and Japan has 126 million people. Italy, at the same time, had more than 56,000 deaths with 60 million people. So I would say Japan tackled this pandemic very well, and you didn't have any big and general lockdown. So I would like to ask you how you do it, and also, since we are talking about MENA region, if drawing from your experience, you have some recommendation for Middle East and North African regions to tackle the same issue.
まず貴重な機会をいただきました。
First, thank you very much for giving me precious opportunity here. And there are 3 and a little bit minutes we are given, and my capability of English can't contain 3 minutes for what I wanted to say. So utilizing the very excellent interpreters, I want to communicate what I want to say. So let me communicate my message here. And to your question, exactly here in Japan, we are a natural disaster-ridden country. So after disasters, we have learned lessons from them. And in the prevention disaster field, we learned lessons from these experiences. We cooperate with the various countries around the world. And in order to be able to respond to disasters, we start to include the disaster prevention in the elementary education curriculum and raise awarenesses in community and workplace, which are all hard and steady efforts exactly so far. And the same goes for our response against COVID-19 very much effectively. We raise awareness among people to respect for hygiene protocol in a school, workplace, and other public places. So that has allowed people actually to conform to a series of such measures as mask wearing, hand washing, disinfection, and having a social distances. So up to a point, the Japanese people were able to follow those. And there are many schools in Egypt which have actually introduced Japanese-style education in the MENA region, and then calling for students to comply with the basic practice, such as hand washing. And I believe and I heard that has helped them guard against the COVID-19 well, according to some reports. And also, it's worth noting that Japan had seen it as valuable to build back better from disasters. So in the context of the pandemic, we need to build back better in not just the health sphere, but wider fields. Now, with the economic activities and government finance declining, and then we now see another opportunity actually to give our thoughts on how all these lead to sustainable development. So that's what the Japanese government has considered so far. And against the COVID-19, quality infrastructure need to be developed, and reduction of the life cycle cost. So with that in mind, how sustainable development should be, and this is exactly what we have considered in this country. So with that perspective, we would like to share the perspective and continue to be a contributor for international community. Thank you.
At the APEC Ministerial Conference in mid-November, you single out 3 aspects of human security that you deem the most important when designing post-pandemic recovery strategies. These are universal health coverage, food security, and women's empowerment. And we heard something about women before. Which would you say it is the most difficult for the MENA region to achieve, and which role can the international community play to support these goals?
Your question was based on my statement at the recent APEC, the ministerial meeting. I believe that the most important issue in the MENA region is the achievement of universal health coverage, or UHC. Of course, there are many countries in the MENA region that have high incomes and strong health systems. On the other hand, it is my understanding that in some countries, the economic situation has worsened due to COVID, increasing the impoverished population, leading to concern about all people not being left behind and receiving adequate health care. The COVID is not an issue that can be dealt with by a single country. It needs to be tackled jointly by many countries. Japan, as a member of the international community, is actively contributing to global efforts to respond to COVID and to achieve UHC worldwide. Japan places particular emphasis on the development of vaccines and fair access by all countries, including developing countries. For example, at the Gavi Pledging Conference held in June, Japan pledged approximately $300 million for now. Of this, more than $130 million will go to the COVAX advanced market commitment to strengthen fair access to vaccines for developing countries. We are also proposing to expand diagnostics through the Global Fund and promote the supply of the therapeutic drugs through patent pools. I understand that MENA countries are also participating in the COVAX facility. I believe that cooperation through such an international framework will continue to be important. Furthermore, the empowerment of women, which you mentioned in your question, is something that I believe can also be further enhanced in the MENA region. Japan has provided bilateral assistance in the field of maternal and child health in various parts of the world, including the Middle East. Through UN Women, we are supporting women affected by COVID in various ways. Going forward, based on the conditions and needs in each country, we will promote measures to empower women who have been affected by COVID-19. The truth is, we have not been able to fully utilize the potential of women, and the pace of change is not sufficient. It is important, therefore, that we see the COVID-19 crisis as an opportunity to change into a better society, and the international society must work together to generate ideas and collaborate in confronting this issue. That's all for me. Thank you.
Okay. So I think that I may be quoting something else for you during the 2019 G20 Okayama meeting. G20 health ministers stressed that global health emergency preparedness, prevention, detection, and response are essential to protect the well-being of people and economies. In your view, which objectives should the international community pursue to ensure that the economic and social recovery goes hand in hand?
先ほど
I mentioned earlier about Japan's contribution to international efforts. I'd like to mention what Japan places importance on in preparing for international health emergencies and in restoring economic and social activities. First, in terms of bilateral assistance, Japan has not only implemented temporary and short-term measures, but also medium to long-term measures to build health and medical systems and strengthen the resilience of each country. As is the case with the maternal and child health initiative mentioned earlier, it takes a certain period of time to build a basic medical and health system, and development of human resources to support the system is also necessary. Within months of the spread of the new coronavirus infection, Japan has provided approximately $122 million in ODA to the Mena region at an unprecedented pace. In addition to assistance through international organizations with an emphasis on speed, Japan has also been working bilaterally to provide equipment and materials to strengthen the medical infrastructure in those countries. In addition, Japan is making the most of the support already provided and is devising ways to utilize existing resources, for example, by providing additional support to hospitals that are the basis of third country cooperation and by supporting COVID research at educational institutions established through bilateral cooperation. The international community should also work medium to long term to strengthen the capacity of countries to enable them to respond to further crises when they occur. Next, I'd like to emphasize that in addition to government initiatives, it is going to become even more important to harness the power of the private sector. Industry, academia, and government needs to cooperate in the development of vaccines, drugs, and medical treatment technologies. The government of Japan will work with the private sector to promote the international deployment of Japan's medical technology and services, and will work with industry to achieve sustainable business operations that contribute to the development of local medical care.
Thank you, Mr. Vashio Eiichiro. Thank you very much for being with us. And I would like to move from Japan to China in a certain way. And I would like to introduce Wu Wongbo, Special Representative of the Chinese government on European affairs. Hi, welcome to this panel. As I did with the Minister of Japan, I would like to ask you first about the COVID pandemic. Just 1 year ago, more or less, the first case of an unknown pneumonia was detected in Wuhan. After 1 year, China overcame the pandemic almost completely, and next year the economy is expected to rise by 8%. So I would say a big success. What recommendation can China offer to other countries, and in particular to MENA country today, and how can international cooperation support MENA, in specific MENA countries, at this stage of the pandemic?
Right. Dear moderators, dear fellow panelists, I'm so glad to see you here. This is the second time I join you in this forum. I have prepared a text, but because of the strain of time, I will go straight to the question first. China has been doing well for good reasons. I would like to say there are a couple of points I would like to share with you. Number one, human life is most important. It is easier said than done, because in China, if we let the virus go rampant, no matter how advanced we are, we could not deal with it. That's why timely lockdown of a city of 10 million people is the best way to do it. We could use the entire country's medical resources, over 40,000 medical workers, to go to one city to handle the problem. If we let the virus go rampant, if we were like the United States and many European countries, we have a lot of medical beds and we have a lot of doctors, we cannot deal with the situation. So this is experience number one. Number two, timely identification of infected cases. If you cannot identify the infected persons as soon as possible, the virus will go around to infect others. Social distance, the use of face masks, and sterilization are also very important. Thirdly, unity. I think the whole country to get united is very important. Imagine a country of 1.4 billion people. Once they have information from the government, they all stay at home. Maybe there are some complaints, but they know restriction of their personal freedom is not only for the family, but for the whole country, for your neighbors, for your beloved ones, for everybody. And the discipline. I think it's easier said than done, again, because to behave in a restricted manner sometimes really challenging. You know, when you go out, you have to put your face mask. You do not shake hands with the beloved ones, and no hug, of course. However, we all know to discipline yourself for time being, then you have a freedom. Personally, I will tell you, in the past 3 months, I have traveled inside China to almost 10 provinces. No problem, everybody's there, everybody's happy, because they suffered for this happiness. So my word for the MENA area is that the international community to get united, to support the multilateralism with the World WHO, the World Health Organization, at its leadership. The World Health Organization has been doing a fantastic job. Their Director General was attacked wrongly. The whole organization was under tremendous pressure. We hope the situation will change. So the united international community will help the country and areas like MENA and South Africa, North Africa, and South Asia. Secondly, we should work together. And sometimes you see countries, people from different groups who have different perceptions will pulling to different directions. Starting with that, that's a failure. You know, some people, they behave themselves, they try not to infect others, but others don't care. The same applies to international community. We should work together as one. No one is safe unless everyone is safe. Thirdly, we have to work very hard to help the poor countries, the needed ones, like countries in Africa and South Asia. At this moment, there are as many as 46 medical teams from China are operating in Africa. The Chinese government decided to allocate $2 billion in 2 years to help the developing countries and least developed countries in their fight against pandemic and for their economic recovery. I think there are a lot we can say, but I have to stop here. Thank you.
Yes, you stressed the necessity for the world to work together, for the state to cooperate against this pandemic. In an interview, I would like to quote your interview at the beginning of September. You stressed that at this stage, to achieve the common goal of development, countries have to put aside ideological differences and engage in unity and cooperation again. But we saw in the recent past how ideological and strategic differences, especially toward China, are present and getting bigger. So would you think that maybe the pandemic will help ultimately to relaunch cooperation between states, or it will get more difficult?
I think that strengthened international cooperation vis-a-vis the virus is possible. First, I think more and more people have realized that ideological differences would provide no cure to COVID-19. For instance, when we had a city lockdown, one European magazine was saying, what China needs is not a modern medicine or medical treatment, but freedom and democracy. But later on, they find themselves lock down their own cities. So ideological differences won't lead us anywhere. With the change of leadership in the United States, I think multilateralism hopefully will be back. And the united international community will be possible. I think there are 3 areas we could work together. Number one, we join our efforts to fight the pandemic, in particular, to make available affordable vaccines to all the people that need it. Many developed countries and China are in a position to make our contributions. We have already joined COVAX, and we say that when the vaccines produced by China are ready, we're going to make it public goods for everybody. Secondly is economic recovery. I give, for example, people think that the Belt and Road Initiative, because of the pandemic, because of the economic slowdown, the Belt and Road Initiative is in trouble. Actually not. The non-financial investment in countries along the Belt and Road region up by 30% so far. And China-European express trains witness more travels than before, although we haven't finished the year. We have more trains this year, 2020, than 2019. This is encouraging. So we think that when we try to bring back the economic recovery, we can make best use of what Belt and Road Initiative. Thirdly, I think if we think of the broader terms, we find a lot of problems we need to address because of the attack of a pandemic. For instance, how could we deal scientifically the future pandemic? The Director General of WHO has already warned the international community, be prepared for the next one. And secondly, we found the public administration is weak. The public trust in government is fading away. And also the public health facilities are not really up to our need. So we come back. There's one thing we keep in mind. If we are going to implement the 2030 Agenda for Sustainable Development, that will deal precisely all the problems we have. So this is area the international community can work together. Thank you.
Thank you very much, Mr. Hongbo, also for the time. You respected time pretty well, and I think I give the floor back to Delaware for the next panelist.
Thank you very much. Yes, we will go to Dr. Ahmed Al-Mandhari, Director General Office for Eastern Mediterranean WHO. I guess Eastern Mediterranean can also mean Middle East and MENA countries. Dr. Mandhari, when you were practicing family medicine, I was professor of microbiology and infectious diseases in Nottingham in the UK. So you and I would have predicted that the global pandemics, which we thought might be influenza or something like that, or SARS, is coming. Nobody probably would have listened, and big guys like Bill Gates and others warned. But you also are on the record for warning against an infectious disease outbreak. But clearly, until COVID hit us, very little was done, and not much of resources were shifted to give health such a priority. Now, you in your position, you're the best person to tell us what major lessons we've learned from this pandemic, and what should be the main priorities in the short term, really, to avoid a crisis like this in the future.
Thank you very much, Dr. Delwar, for giving me the privilege and the chance, to come and join this esteemed platform. And answering your question, in fact, I'd like, just based on the remarks given by colleagues, the speakers before me, I would like to share, 2 facts before I give my answer. Fact number 1, and which we are all aware about, is, that the pandemic itself demonstrated to us the value of freedom. The freedom to move, the freedom to be with those whom we love, to live in dignity and security for ourselves, and also for those who are outside our sort of circle. Like, for example, the refugees, the migrants, the IDPs, and those people with downtrodden. Fact number 2, national health systems and structures in place to manage health security challenge, having them in a very strong manner, as you have mentioned, is really very, very important. And this includes establishing public health emergency operation centers, which is a common terminology that have been introduced by WHO and many other organizations. And this pandemic has shown us that countries with a strong incident management system and experience were very quick, to mobilize whatever resources, as His Excellency mentioned about the experience of Japan, the experience of China, and some other countries. Now, the lessons that we have learned from this pandemic, the COVID pandemic itself, to be honest, has illustrated to us that many countries, not only in IMRO, but around the globe, have not invested enough in comprehensive preparedness and emergency response systems to protect people's health from disease outbreaks, let alone, from this big shake to global shake. The second lesson, in fact, in addition to the pandemic responses and operations, progress in health services that have taken us many years, like maternal and child health, fighting other communicable diseases like TB, HIV, malaria, fighting non-communicable diseases. When this pandemic came, it really shook all healthcare systems. It moved and shifted all or almost most of the attention to the pandemic, forgetting about those programs and those group of people. And I'm sure if we go to statistics, we will witness an increase of the number of the, say, morbidities or mortalities in non-COVID related health problems and programs. Now, the priorities for us, when we talk about things that we need really to act now, I think we have to have, a very strong strategic response in terms of planning, based on a very thorough assessment of existing strengths in our system. What are the opportunities for improvement? I will not call them weaknesses, but opportunities for improvement, and whatever gaps that are there. This is very important. The second point that I think we have to have a very good understanding of both the hazards that countries are prone to, and also the health system capacities that will allow us to effectively identify whatever targets and have a balanced action. And the last point is the regular testing of whatever systems we have in order to make sure that, yes, we have prepared the system is meant to deal with emergencies, and it is really well prepared by testing it on and off regularly through different types of assessments.
Well, thank you very much. I think you touched on very important areas, and the value of not only the international collaboration, but multidisciplinary approach, as well as mobilizing funds and resources. So I'm not going to dig deeper here, but ask you one key question. We are facing a lot of poor or weak governments, countries, some of them dysfunctional, some of them have neglected healthcare system and therefore unable to provide good health services. Now, you're a reformist and you have seen many of these poor or dysfunctional countries. What would be your best advice for improving the standard of their national health system and maybe underpinning their health security? So from your experience, please.
Thank you, Dr. Dulwar, for this important question. In fact, this pandemic has shown us, as you said, a lot of opportunities that we need really to develop and improve. One of the advices, to national healthcare systems that at a country level, WHO from the beginning of the pandemic have been asking countries to move as, based on the concept of the whole of government and the whole of society and the integration between the two. And when we talk about the government, it is all governmental sectors, plus, as have been mentioned earlier, private sector as well, and the integration between the two. Every individual here, when it comes into each country, have a role to play. And that's why in IMRO, in fact, we introduced 2 years back, when I joined the office, Health for All by All. It is a call for action and solidarity. Otherwise, we will not be able to deal with any health challenge that are facing us. The second point, we have to have a sort of, national and local authorities working together in order to effectively implement whatever plans that have been made at a national level, at strategic plans. The third point, we have to have, trusted and accountable leadership, which is very important at all levels to fight this pandemic and many other health challenges that are faced by many countries. And authorities at all levels, as I said, and across all sectors must govern and work together in order to make sure that our citizens are really healthy and having the well-being under the umbrella of the SDGs, the 17 SDGs. In addition to that, in order for this should ensure that policymakers or policymaking is coordinated, consistent, and inclusive, and it should reflect really, the evolving needs of the population. Utilizing the collaborative network is another important point, such as, the influenza centers, national influenza centers, which really helped us a lot during the initial stages of the pandemic in terms of tracing, recording, testing, these sort of things, and sharing information. And we have a lot of regional programs for the development and strengthening of rapid response capacities within countries, and what we call them, early warning systems, which have been utilized easily in countries, even in countries with emergencies. Okay. So these are the messages that I would like to share with authorities in each country to keep strengthening their systems.
Well, thank you so much. That's been really clear and very helpful and highly focused. Over to you, Enrica, and thank you very much, Dr. Mandhari.
Okay, let's go back to the beginning in a certain way, because we started this panel talking about how the pandemic stressed that how it's important to improve and get better the food system to sustain the world. And innovation, cooperation between local level and international level, big data, that all helps to get a food system better. So I would like now to introduce and pose some questions to Valerie Guarnieri, who is Assistant Executive Director of World Food Program. I see you connected. Welcome to this panel. First of all, World Food Program won the Nobel Peace Prize 2020. Food as system, a step to peace and stability. Normally, war and conflicts are the biggest challenges to achieve zero hunger, but the spread of the virus is a problem too. So in which way, in your opinion, has the pandemic increased the threat of hunger around the world and in the MENA region in particular, just to start?
To be here on this panel and for that question. And we have seen hunger on the rise for the past few years, conflict and climate being the main drivers. And then this year, we've seen COVID come on top of that as a shock multiplier, pushing hunger to historic levels. As a result of that, we've seen an 80% increase in the number of acutely food insecure people, 270 million people now falling into that category of acutely insecure and food insecure. And it's less in this case about the virus itself, as devastating as that has been, and more about the socioeconomic impact that has unfolded. And Mena is not at all immune to this and is in fact very much affected. And why? One, because Mena is one of the highest importers of food. Most of the Mena region depend on imports for about 50% of their food needs. It's also a very water-stressed region, dependent on oil prices, which have been affected. Conflicts and crisis in the region have produced tremendous levels of displacement and concentrated populations. There have been currency fluctuations that have affected food prices around the world. And here we've seen 20 countries that have seen a 10% increase in the price just of basic staple food products in the market. And in MENA, we have 3 countries, Sudan and Lebanon, have seen a doubling of some of those basic food prices, and Syria has seen a tripling of those prices. So what we found is that populations are impacted in several ways, including in this region. They've on the one hand seen food prices go up in their markets, and on the other hand, they have suffered from job losses, from losses in remittances, which make it all the harder for them to afford the food that is available. It also highlights and affects the capacity of responders like our organization and other partners to respond, and shows the fragility of food systems and fundamentally the inadequacy of current food systems to ensure access at all times to safe, affordable, and nutritious food for all, and to be doing this in an equitable, resilient, and sustainable way. So all of this has come together with the COVID crisis.
Can you tell us more about how exactly the World Food Programme responded to this crisis, launching a very big operation?
From the beginning, we sought to sustain operations for the 100 million most vulnerable people who we're assisting on an annual basis. And we know that that population, already dependent on food assistance, would be hit hardest of all. In order to sustain, we put in place adaptation measures in our programs to ensure that we could protect the safety of both those receiving assistance and those providing that assistance, our staff and our partners, a massive deployment of protective equipment and adaptation of modalities of distribution of either food or cash support to reduce contact, to increase social distancing, all of the measures that we're applying ourselves in our day-to-day life. We also faced real constraints, not just WFP, but the entire humanitarian, health, and development system response, just with moving people and goods around, with the disruption to commercial transport that we've also all suffered for. So we put in place a common services system in order to ensure that we could move, and that humanitarian, health, and development personnel could move to their site and out of their sites of operation, and to deliver cargo. 25,000 passengers moved through these humanitarian air services, serving 389 organizations, 90,000 cubic meters of cargo delivered, including protective equipment. So this basically enabled the health and humanitarian systems to stay and deliver, filling gaps in where governments were unable to work. So sustaining operations was absolutely key, but also scaling up operations, because what we found is an increase in the numbers of people affected, and urban populations are among those where we hadn't traditionally worked as much, and where we've had to scale up our work to support urban populations. And one of the ways which we've done that is by increasing cash transfers to populations in areas where food is available in the market, but people just can't access it because of cost. And so already we've provided more than $1 billion in cash transfers directly in the hands of people to increase their access to markets. In addition, it's been very important to really focus on national systems, and working with partners, we've been helping governments to adapt national safety nets and social protection systems that provide basic education and nutritious services, and ensure that those social protection systems are expanded to include new categories of vulnerable people, like urban populations, like migrant populations, like informal workers who were previously able to cope. And data has been absolutely critical to the entire response. And so, again, working with partners, ensuring that we had remote monitoring systems in place, which we now have in 44 countries, including 20 in the Mena region, so that we can be tracking the impact on hunger, on markets, on a regular basis, and providing that as a global common good through the Hunger Map Live system. So all of these measures and more have been deployed as part of the response.
Do you think that this pandemic, the interaction between organizations like yours and government and state has got better, or you still find the same difficulties if you do so?
Main difficulties, and it's because of access difficulties that we're now seeing that this convergence of conflict, climate, and now COVID have led to 4 countries on the brink of famine, and we're very concerned about the real prospects of famine in Yemen, in South Sudan, in northern Nigeria, in Burkina Faso. And famine only occurs when access of populations to basic services and actions of organizations like WFP in reaching populations is blocked. So better cooperation is absolutely needed there. But at the same time, COVID has demonstrated, and several of the speakers have highlighted this, the interconnectivity of our world and our work. And we have seen the importance of multilateralism reemphasized. The Nobel Peace Prize Award is a sign of that. We've seen governments, despite facing fiscal constraints in their own countries, stepping up yet again to provide support for humanitarian solutions that work and effective organizations. And we've also seen a growing appreciation that we need to be building on moving forward to ensure that there are stimulus packages and debt postponement and actions in place to ensure and increase the fiscal space that nations have in order to respond to the crisis. We're going to need to keep the focus on this and further strengthen international cooperation. This is a global pandemic, and global solutions are absolutely key.
Okay, thank you, Valerie Guarnieri, very much for these interest points you made out, and I think I give the floor back to Edouard for the last 2 speakers.
Thank you very much, Enrica. We now go to Ms. Baiba Braže, Assistant Secretary General of NATO, and with the pronunciation of her name, she smiled. I tell you what, not a single person in this room have so far got my name right. 2 consonants makes Delaware very difficult to pronounce, but I hope I've done yours right. And welcome. NATO has been challenged by many issues, whether they are political, security movements, and so on. But health and COVID have really been challenging and will have impacted your remit. Now, you can tell us better than anybody else which are the main security implications of the health crisis in the MENA region, and how you managed to respond to it. What measures NATO has taken to address them, please?
Well, thank you very much for having me today. And I would first like to thank the organizers, the Italian Institute for International Political Studies and Italian Foreign Ministry for organizing these very interesting discussions. And you have personal greetings from the Secretary General Jens Stoltenberg, who asked me to represent him today. And what I will shortly explain will be both around what NATO has done itself, but also how it has indeed helped the others. As you know, NATO's core tasks are three: collective defense, crisis management, and cooperative security. The response in the situation of the pandemic has been, of course, across all three tasks. So the first, the collective defense, NATO was able to maintain its defense and deterrence ability to guarantee security for its billion citizens. We did adjust our operations. We did cancel some exercises and made other adjustments, but overall NATO was able to ensure that its mission is continuing. In this, I would also in particularly like to thank Italy. It has been a great ally. Not only Italy was able to continue its work in international missions, be it in Afghanistan or Kosovo or Latvia, but also we saw that Italian military played a very important role inside the country, and the whole society, the resilience of Italian society has been overwhelming. So indeed, that has been something that we all noticed. On crisis management, obviously crises like pandemic, we all exercise for a variety of crises. We all have plans in place. So resilient institutions and plans are essential in this respect. And as part of that, NATO was able to respond both each ally nationally, despite NATO not being the first responder in the health crisis. We saw that there were militaries helping civilians, militaries helping medical institutions, guarding borders, providing logistical help inside the countries. So that was very clear a response that was there in the allied countries. But also we saw that allies had solidarity. They were able to help each other, and they were able to help partners. We saw that allies flew more than 350 flights to help with thousands of tons of medical supplies, equipment, more than 100 field hospitals, and over 25,000 treatment beds. So that showed also that in terms of crisis management, NATO was able to deliver for the allies, but also for the partners. On cooperative security, this is where obviously our interest comes in, that NATO is more secure if countries in the neighboring regions to NATO are secure, are resilient, stable, and economically developed. So NATO has a very wide partnership network in the world, and very important region for NATO obviously is Middle East and Northern Africa. For more than 25 years, NATO has been involved with the partners, both as partners in the Mediterranean dialogue, but also in the Istanbul Cooperation Initiative. Ministers, our foreign ministers that just concluded a meeting yesterday actually also had a report on Sahel. And our partnership and our assistance has been very much around building resilient, stable, secure institutions to be able to guarantee the security and stability. Because again, even with health crisis, we clearly see if there are no resilient institutions in the countries, it's very difficult to respond and prevent health crises.
Right. Well, yeah.
All right. Yep.
You're going to round up with a final point, or shall I move to the next question?
Sure. As you wish. I'm here to answer your questions.
Okay. Well, there are two questions that maybe I should direct to you. One of them is to do with NATO's obviously exploring new territories, and one of the new territories for you is dealing with information and misinformation. And COVID pandemic has been a fertile ground for all sorts of false news and misinformation. And clearly conflicts and instability always makes information and communication harder. So tell us about that new investment from NATO.
Thank you very much for that question. But first, let me also just say, to conclude the first part, is that a little bit on the assistance we provided to the Mena region. It was very clear that it was a priority. So we saw that allies prioritize that also in their actions. So be it in Afghanistan or in Iraq, in coordination with our NATO mission there, Spain delivered medical equipment, oxygen masks, and so on and so forth. Also, others provided ventilators, more than 350,000 euros. So a lot. Tunisia received help. So we did everything that we could. Then on the disinformation, obviously, we saw, and we also have discussed that very widely with our international partners, that there was a big wave of disinformation, which is part of hostile information activities, but also misinformation, that is the distribution of information that might not be truthful, but without a hostile intent. So in that respect, what NATO did, we made sure that our own communications are in order, that we have proactive communications in place. We made sure that if we see the hostile information activities against NATO, we debunk them as quickly as possible. We made sure that our people are safe and secure, so we actually have people who are able to follow, assess the information, and respond. And we invested and prioritized in digital communications. That is as far as communications is concerned, but we are also looking into how to strengthen resilience of societies. And as one of the previous speakers said, in terms of pandemic, but not only, it's not only the whole government approach or the whole organization approach, it's the whole society approach. With the advance of digital age, we have to make sure that our citizens are digitally literate, that they have the skills and the knowledge to separate what is hostile information, what is meant to undermine our institutions, and what is just entertainment, and what is meant to educate them and to be part of the wider digital success of our societies. Right. So we announced, you might have noticed, a new initiative, so-called resilience grants, which were asking various civil society organizations, groups of societies, institutions, think tanks, to file projects with regard to innovative response to disinformation. And it's been quite a pleasure to see how many different projects have come in and how many have been implemented around, both for the youth audiences, but also for very particular audiences, older people, military, and many others, to very much provide them with skills to respond.
And in the interest of time, I'm going to hit you with one final question. Sure. But if you decided that it's unfair, feel free to skim through it or ignore it. Well, clearly NATO was not only challenged by COVID and the changes in environment, but it was also challenged by the US president, the Turkish president, but with the turmoils that we've experienced previously over the last few years. But I'm interested in understanding what's the future for NATO. How do you see those accommodated, those challenges accommodated to have a better roadmap for the next few years?
It's a very good question. As you know, the Secretary General has announced the initiative, so-called 2030, NATO 2030, which is very much around the adaptation. In its 70 years, NATO has adapted quite a number of times, and this is what we are doing currently. And that concerns both the military parts, what capabilities do we need to be able to respond to all threats that are there against the allies, in terms of emerging security challenges, in terms of potential adversaries. Traditional threats have not disappeared, new have appeared, but also around the political unity of the alliance. The alliance is indeed the platform where Northern American and European allies can discuss all the issues. And it's the alliance of values. It's part of our 14 articles that forms the Washington Treaty. It's our values as democratic societies. That's why we have committed to defend each other. So this political union, political alliance is really at the heart and in the DNA of who we are. And we have to be able to sort whatever difficulties we have among ourselves. And then the third pillar, more global approach. We have countries, we have partners across the globe, be it in MENA region, be it in other, and they are all important to us. And there are different ties that unite us, and there are different issues that unite us or differentiate us, but we still have to be able to engage, to understand, and to together minimize those threats that are there, be it climate change. For example, yesterday, foreign ministers discussed also China, and it was very clear that on climate change, China, we need absolutely to engage with China, because when we look at the global emissions, it's not going to be enough if just the allies do it or European Union does it. So there is a need for more global approach to ensure that our security, be it in the NATO states or MENA or other regions, is not affected.
That's excellent. You've tackled it very well, and I'm delighted. And I couldn't let you go without asking you this question. This was a unique opportunity. But thank you very much, Dr. Braže, again. And we're going to move to a final speaker, and that is Dr. Serwan Esmaeil. He's the Secretary General of the Iraqi Parliament Council of Representatives. And he's representing his boss as well as himself. And being from the Iraqi parliament, we can't ask too many questions about what the government of Iraq would want to do. But from your point of view, Dr. Esmaeil, we want you to update us on really how Iraq or even your parliament is facing those challenges, be it health, economic, security, and so on, because COVID exposed a lot of structural and functional weaknesses in Iraq, and the parliament is a center of focus. So please tell us how you're addressing those.
Thank you very much, Prof. Aladdin. It's such a great honor to be here today on behalf of myself and Mr. Halbousi, the House Speaker of Iraqi Council of Representatives. I want to thank you for your invitation and to be participant in this conference. And it was very insightful to hear from the many perspectives on the issues facing the world right now. I hope that this conference is successful, can create strong partnerships, and is a stepping stone for a brighter future for all of our countries. Although this conference is taking place during unprecedented times due to the hardships of COVID-19, which have affected the entire world economically, socially, and politically, it's now more important than ever to come together to find long-term solutions to the tragic effect caused by this horrific pandemic. Iraq is similar to the rest of the world, has faced many hardships economically, socially, and environmentally. There has been a stop to normal life. As we previously knew, due to the thousands of the people being affected and lost their lives. In regards to the economic reform, the parliament and the government are taking the necessary measures and procedures to fight the corruption, control the entry borders, activate the agriculture sector, as well as support local entities and products. It's a priority to expand the private sector by giving business loans for investment projects, supporting youth to enter the business field, and promoting entrepreneurship. And security-wise, the Iraqi government is tightening all of its focus on to control the areas of regions that are influenced by ISIS activities. As we all know, the role of Kurdistan regions and also the Peshmerga with the Iraqi national forces were able to defeat ISIS through the cooperation between the Iraq and KRG, are continuously monitoring these areas by using armed forces and securities to abolish ISIS and restrict their movements within the Iraqi borders. The Iraqi army is also getting a high level of training through international cooperation. From here, there are several key elements that we need to focus on for the betterment of Iraq. The priority now needs to be societal peace, stopping this spread of fugitive weapons, decreasing the militarization of society, and minimizing internal conflicts. We need to activate the diplomacy efforts nationally and internationally by bringing all to the round table for open dialogues and discussions. Most importantly, we need to prioritize education and the development of higher education, because they are the key solution for every country's and society's development. The Middle East and North Africa do not live in a safe environment due to the outdated ideologies. The political revolutions that removed previous regimes in turn just created chaos and new unexpected movements. The military and political interference by some other countries have also caused wars and instability in the region, to the point that thousands of citizens have been displaced and have now immigrated to the other countries. We need to come together united and go back to the original principles of leadership by getting rid of the political and dirty intelligence games. We need to focus on creating real peace and strengthening all our relationship through active diplomatic effort. We can all benefit and prosper by creating a healthy and peaceful environment. It's our duty now as participants of this conference to find solutions to help one another overcome the obstacles that not only Iraq is going through, but many other countries as well. Although no two countries are the same,
Dr. Esmaeil, can I just interject, because I got your key message, but let me help you focus on a key question. With the pandemic starting, there was a huge drop in oil prices, and along with other security and political crises that Iraq was already suffering from. But the Iraq being a single commodity economy, i.e. just oil dependent, it's now virtually unable to pay salaries adequately. Now, the government submitted a white paper to the parliament that contains a lot of reforms, a very comprehensive approach, and the parliament approved it. It's been a while now. So what happened to the white paper and what happened to its implementation?
Yes, sir. As you mentioned, due to the war and COVID-19, the ISIS war, and also some interference from regional and international countries with an internal situation in Iraq especially. We are facing too many challenges. As you mentioned, one of them, the economical situation, so crisis. And regarding this, it's our priority in Iraq to have a diversification strategy that doesn't focus so heavily on oil prices. In regards to this economic reform, the parliament and the government are taking the necessary measures and procedures to fight the corruption, control the entry borders, activate the agriculture sectors, as well as support local entities and products. It is a priority to expand the private sectors by having business loans for investment projects, supporting youth to enter the business field, and promoting entrepreneurship like the rest of the world. COVID has significantly stopped our economic developments, but we are slowly going back on track. However, we need more cooperation and support by international community as to benefit from their experience, as well to have some loans and financial support and funds in order to be able to pass this difficult time and crisis.
Well, thank you so much. Very clear and very well articulated message. And I thank you so much for your contribution. We are a little over time. I was supposed to round up and summarize, but I'm not going to do a detailed one, except emphasize that most speakers, in fact, all speakers, emphasized during a pandemic or crisis of this scale, they emphasized cooperation, international cooperation, collaboration, and communication. That's 3 C's. And then a lot of them talked about the necessity of finding ways of resource mobilization and a multidisciplinary approach. But everyone emphasized the big role that the international agencies such as FAO, WHO, NATO, and others play, or Mediterranean Union, and so on, in providing a better environment for dialogue, for cooperation, and for tackling these type of challenges, be it security or health. But importantly, most of you emphasize the need to come up with being proactive and come up with creative and innovative ways of facing those challenges. I think this would probably be the summary that I would present and leave you with the host. But before that, I want to thank Paolo Magri and his wonderful team and the entire ISPI family, who have really done a wonderful job over the last week, as every year, in tackling those difficult subjects, in creating a good platform and attracting so much attention and from the viewers. So on your behalf, I want to thank them, but I want to thank every speaker for sticking to time. Having 10 people speaking in an hour and a half, it was a challenge, but we've actually done very well. I don't know, Enrica, if you want to say goodbye or, and finish it off.
Thank you. You said everything very well. I just say that I hope to see you, all of you, back in person in Rome next year, and the pandemic will be over, and maybe, who knows, the world will be better cooperating each state and the organization. So thank you to Med Dialogues, and see you next year.
Ciao.